Hi everyone, I am Palak from group 322. My today's topic is kinematic of knees and walking and running. Kinematics of knees involves study of motion of knee joint without considering the force that cause motion. The knee is a complex hinge joint that primarily allows for flexion and extension, but it also has some degree of rotational movement. Anatomy of knee joint. Bones involved. The knee joint is formed by femur, thigh bone, tibia, and patella. That is also known as kneecap. Articular surface. The femoral cordyceps articulate with tibial plateau while patella glides over femur during movement. Degrees of freedom. The knee primarily allows for 2 degrees of freedom, flexion and extension. The primary moment where angle between thigh and lower leg decreases or increases. Internal external rotation occurs when knee is flexed, allowing some rotation of tibia related to femur. Range of motion. Flexion. Typically knee flexion ranges from 0 degree to about 135 to 150. That is the maximum in healthy adults. Extension. Full extension is considered 0 degree, while some individuals may achieve a hyperextension of a few degrees. Rotation. Internal and external rotation is limited and varies depending on knee flexion. It is generally around 10 to 30 degree when knee is flexed. Kinematic analysis. Gait analysis. The kinematics of the knee can be analyzed during walking or running to understand its role in locomotion. Joint angles measurements are often taken using motion capture systems to quantify angles during different activities. Velocity and acceleration. Kinematic studies may also involve analyzing speed and acceleration of knee movements during various activities. Functional importance. The kinematics of the knee are crucial for activities such as walking, running, jumping. Proper kinematic function is essential for maintaining balance, stability and efficient movement patterns. Pathological considerations. Abnormal kinematics can lead to injuries or conditions such as arthritis, ligament tears, or patellofemoral pain syndromes. Understanding knee kinematics can aid in rehabilitation and designing interventions to restore normal functions. Measurement techniques, motion capture systems, internal measurement units, and goniometers for measuring angles and directly. Walking and running. Walking has phases like phases of walking. Walking can be divided into two main phases, the stance phase and the swing phase. Stance phase approx 60% of gait cycle. Initial contact, heel strikes the ground. Loading response, body weight shifts onto forward leg, knee flexes to absorb shock. Mid-stance, body is directly over supporting leg, both feet are in contact with ground. Terminal stance, the heel of supporting leg shifts off ground as weight shifts forward. Pre-swing, the opposite leg begins to prepare for its swing phase. Swing phase approx 40% of the gait cycle. Initial swing, the foot lifts off the ground and begins to move forward. Mid-swing, the leg continues to move forward with the knee flexed. Terminal swing, the knee extends, preparing for the next initial contact. Joint movements, the hip, knee, and ankle joints all work in concert to facilitate smooth movement. During walking, the hip flexes and extends, the knee flexes during loading and extends during push-off. And the ankle dorsiflex when lifting the foot and during push-off. Energy efficiency. Walking is a low energy activity, primarily relying on elastic energy stored in tendons and muscles. The center of mass moves in a sinusoidal pattern, which helps conserve energy. Balance and stability. Maintaining balance is crucial. This is achieved through a combination of vestibular input and visual feedback. Mechanism of running. Phases of running. Running also consists of two main phases, stance and swing, but with distinct characteristics compared to walking. Stance phase approximately 40% of the gait cycle. Initial contact. The foot strikes the ground, often with a mid-foot or forefoot strike. Loading response. The body absorbs impact. There is less time on the ground compared to walking. Mid-stance. The body is over the supportive leg, but this phase is shorter than in walking. Propulsion phase. The push-off offers as the toes leave the ground, generating forward momentum. Swing phase approximately 60% of the gait cycle, similar to walking but typically involves greater knee lift and hip flexion to allow for increased stride length. Joint movements, greater ranges of motion are seen in running compared to walking. Increased hip flexion and extension, knee flexion during the swing phase and more pronounced angle plantar flexion during push-off. Energy utilization, running requires more energy than walking due to increased muscle activation and higher metabolic demand. Elastic energy storage in muscles and tendons is critically for efficient running. Flight phase, a key difference in running in the presence of a flight phase where both feet are off the ground simultaneously. This phase allows for increased speed and is characterized by a more pronounced upward motion. Balance and coordination. As speed increases, maintaining balance becomes more challenging. Runners rely on core stability and coordination to manage their center of mass. Key difference between walking and running. Speed and stride length. Running generally involves faster speeds and longer strides compared to walking. Ground contact time. Running has shorter ground contact times, especially during the propulsion phase. Energy expenditure. Running requires more energy due to higher intensity and muscle engagement. Thank you.